Hi, welcome to the Global Health Beat, where we're talking about the trends, nuances, and opportunities for HCP engagement globally. I'm Amanda Prito, joined today by my colleague, Matt Durham, Director of Global Media here at CMI Media Group, and our partner experts from Ogilvy Health, Nadine LaFond, President, and Paulina De La Riva, Chief Strategy Officer. Today, we're going to focus on what pharma and healthcare marketers need to understand for successful engagement with prescribers in Canada. So let's get started. Hi, Nadine. Thank you so much for being here. You are in two very exciting roles. You are president of Ogilvy Health Canada and now also client engagement officer for North America. So, what we'd love to hear you talk to our audience about is what are you seeing as distinctly Canadian ways that local HCPs are engaging with media compared to what we're seeing in the US?
Thank you so much. So glad to be here to have this conversation. I think the first big difference between the US and Canada really is the scale, right? We always look at Canada as being 10% of the US, but when it comes to healthcare, we're actually a little bit less than 10%. And so there's a lot of activities that are done in a very personalized, precise way. But in terms of segmentation, we see sometimes in the US some brands having 5 different customer segments, while in Canada we might activate 2 segments because of the cost relative to the size of the audience of adapting that much material. And so that's the first difference. And the other difference, of course, is just the notion of the proportion of investment between healthcare professional and direct to consumer communications.
So at CMI, we have something called Media Vitals Research. That is a really robust piece of research that looks into media habits and channel preferences of HCPs. And historically, that's been a US piece of research, but as we expand globally, we're expanding that into other markets, with Canada being the key one. So we're now sitting on a lot of proprietary data about the media habits and channel preferences of Canadian HCPs. It really struck me how Canadian HCPs were actively engaging with lots and lots of channels. One stat I was looking at was saying about how Canadian HCPs are engaging or listening to medical podcasts weekly. 65% of them are engaged with medical podcasts weekly. Whereas we look at the same number with European physicians, and that's about 50%. And it's similar in the US.
Excellent addition, Matt. I love to hear that we have the new Global Media Vitals data in-house and can't wait to see the insights that come from it. Paulina, let's move on to you. And in your role around strategy, what trends have you been seeing over the last few years?
Yeah, so it's pretty evident that the pandemic accelerated a lot of these consumer behaviors and the adoption of a multi-channel approach, or the acceleration of the enablement that certain companies are doing in order to be able to have a more integrated or personal plus non-personal engagements, right? So we hear from Matt all of these new adoption of channels and what are they doing with their with their time outside of practice in order to be able to educate themselves or advance their knowledge in particular areas of expertise. How can we intersect in those engaging opportunities in a more meaningful way, and how to bring the core element of the right insights and the right human understanding to those, so that our message does not just appear right where they are currently engaged or where they're consuming their media and time, but also to drive more meaningful conversations and ultimately effectively conversions for our clients.
And are you seeing a difference in those trends and those consumption habits in different regions, different provinces across?
Yeah, that's a really good point. We have to consider all of those differences, right? Like the practice in one region or one province versus the other might not be the same. And if you tap into really diving into the customer journey, we can recognize points where perhaps there are some people that need a little bit more education in certain provinces, and there might be others that actually are looking for more like that admin burden to be relieved. So in order to find the right opportunity for brands to engage, we have to tap into those nuances and truly understand the practice reality and also the difference province by province to be able to provide more meaningful value through our engagements.
What we tend to forget sometimes is that Canada is divided across, 10 different provinces. And there's different variations in the reality of the healthcare professional in these provinces. In Alberta, for example, there's a lot more prescribing rights for the pharmacists. That changes the dynamics within the overall HCP landscape into who does what. In Quebec, There's always a different set of reimbursement criteria for products than in Ontario. And British Columbia is also very different, having a much broader patient base that is on the provincial insurance plan as opposed to private payer. And so there's a lot of differences, both from a cultural standpoint, from a regional standpoint, from a role of the healthcare professional standpoint, as well as access. And that really impacts and creates a lot of need for adaptation. And yet the challenge is having the scale to have all of the different versions. And so we have to be really agile in how we test and learn and have fewer versions to adapt, but really think about the overall customer journey. We may not have 50 different ads, but we are still able to plan for the right experience based on where the customer is in their adoption journey. And that adoption journey may change depending on their local reality.
And then there's also the misconception that when we're thinking about those targeted approaches, it means like more work or more assets, right? As Nadine is pointing out. And it's really just about having the right framework to take decisions, right? And that can be a decision in like, who do we need to engage first? How do we prioritize our efforts for where we see the biggest opportunity? And then how do we bring that intermedia assignment and the channels that we're deciding to go with? It's a really nice way to think about how to frame your priorities and bring those efforts to life.
Alina, you mentioned the term human-centered design. Could you tell us a little bit more about what you mean by that term and specifically what it means for media?
Well, we want to think about as we start to activate orchestrated media and as we start like engage in specific points in the customer journey from a media standpoint, we can certainly start to think about customers beyond the traditional engagement channels, but how do we bring like orchestrated experiences where perhaps we're looking at their exposure to the mass media, right? When we're thinking about them out in the outside world. So Matt just mentioned, for example, like podcasts. So the human-centered design piece of that is perhaps they are actually having, a hard time being on screen for a longer periods of time because they're working all the time and they're using their personal space to kind of like educate themselves and hear some opinions from peers and so on. So like if you think about it from the human experience, you can actually tap into media in a more effective way and utilize it orchestrated with your current, like let's say standard or baseline efforts to kind of like elevate a little bit your brand presence or your message in a way that it's more meaningful and interesting for them.
Matt, you mentioned a brand new proprietary research from Global Media Vitals. What have you seen that they can share with their clients and brands of actionable insights from the new study?
That's a great question. One of the first things you're doing is you're going to all of the suppliers, and essentially you're asking how many HCPs of your target audience are on that platform and how engaged they are. When we are looking at Canadian HCPs and where they are online, we generally tend to see them congregating more on international platforms, more than some of the domestic Canadian platforms. That's not to say that the Canadian platforms aren't great and don't have good, decent usage, but we see much larger numbers of HCPs on the international platforms. So I guess one recommendation would be to kind of, if you're building a media campaign for Canadian HCPs, is to think beyond your national borders. There are opportunities at the international level that can be geo-targeted and reach your HCPs and more of them a lot of the time in impactful ways. Now, there are some exceptions, like if we're trying to reach GPs or family physicians in Canada, then you kind of go to Canadian Family Physician and they're all going to be there. But when we're trying to reach more of the specialist audience, oncologists, cardiologists, etc., it's surprising, and we don't see this in a lot of other countries, but they seem to be much more, they have an international mindset, and they go into international source of information or connecting with peers internationally that we don't see in other markets.
Something that we always recommend as well is like orchestration doesn't come just at the end when you're trying to kind of like activate and put everything in market. It actually starts at the beginning, right? And so if we want to take these decisions from like which media and how we are activating all of these efforts in an integrated way, we recommend bringing your partners at the beginning and engage them in the same conversations. That's very key for success.
It also is critical to make sure that your media partner really is able to do a thorough analysis. And oftentimes what we find is that some of the newer Canadian platforms to reach healthcare professionals don't always have the reach that we hope. When we match target list, we're often disappointed with the match. And oftentimes they aren't on Canadian properties. They may be, especially for specialists, on international properties, and there are ways to reach them and to qualify healthcare professionals as Canadian and be able to really target them that way.
So, Nadine, as we conclude, I'd like to leave our viewers with what is something that would surprise them or has surprised you about HCPs in the Canadian regions versus outside of Canada?
I think the key thing that might surprise people about healthcare advertising in Canada is that you actually can reach consumers, right? And sometimes you are speaking to healthcare professionals in a consumer environment as well. And so we are a very regulated market, and it comes with a need to fully and thoroughly understand that environment. But we are seeing more and more the benefit of really ensuring that conversation between the patient and the healthcare professional. And consumerization of health really is a thing in Canada as well. And so we're seeing a lot of brands really complement their healthcare professional investment with direct to consumer investment. It used to be reserved to brands that had more leeway, such as vaccines or really, really big budget brands. But now we're seeing even rare disease products that have a very small audience of patients really tap into that. And so it takes a partner that knows exactly what they're doing, but direct to consumer is possible in Canada under very different regulatory contexts.
Paulina, so what are you seeing and what can you share with us?
There's a big opportunity to reframe how we're expecting to drive brand building and how we're expecting to drive performance marketing. And it has to do with like taking the right steps towards measuring your performance of integrated efforts so it can be both omni-channel or let's multi-channel or non-personal, and as well with your sales force. So really bringing all of that together to truly understand what's driving the performance of your brand and how to make it more effectively in the long term.
That's an excellent point. Like, I don't think the importance of reporting and optimization can be understated. I would say a lot that how a campaign performs in month 1 should look nothing like how it performs in month 6 or in month 12, because we're always looking at the results and therefore always trying to optimize and improve the campaign.
There is so much that we can learn from a creative and messaging standpoint as well, right? Even just looking at where customers are clicking once they come from web banners onto your website. What content are they consuming afterwards really gives us a lot of information. And it's also true for the different tools that reps are using. We really need to have the discipline to do this on an ongoing basis, and we can learn so much.
These were such excellent insights. Thank you all. I know I'm walking away from this discussion hearing the importance of strong partnerships, activating an omni-channel approach at the beginning, starting with data and measuring all along the way. So much to learn and understand about Canadian prescribers. Thank you so much. Thanks for joining us on the Global Health Beat, and remember to like and subscribe.